Welcome to the PHAB Center for Innovation 21st Century Learning Community Interview Series. In each video, we hear from public health leaders about their work and what they've learned. I'm your host, Travis Parker Lee. Today, we discover how two public health organizations use assessments as a tool to determine gaps in their public health systems. With me today are Daniel Bogle, Health Policy Director at the Missouri Department of Health and Senior Services, and Jamie Michael, Executive Director at the Wisconsin Association of Local Health Departments and Boards. Thank you both for joining me today. Daniel, historically, Missouri hasn't kept pace with investments in public health. What did your department decide to do about it?
We know that Missouri, when you look at the per capita spending from the state into public health, that we're 51st when you look at the 50 states plus DC. And so we know that's not good enough for our local public health partners. And so what we're doing is we have adopted the Foundational Public Health Services model, a Missouri-specific one that was designed by a grassroots organization called Healthier Mo that brought together local leaders as well as academic partners and the State Department. And then there was a capacity assessment that was conducted to evaluate where the LPHAs are in the course of implementing Foundational Public Health Services. Where we're at right now moving forward is that we have a contract with the University of Missouri to actually do a cost gap analysis or costing assessment in which we are going to, over the next 3 years, take a look at where the money is coming from, where it's going, and receive self-reports of what that looks like for each LPHA in terms of their capacity for the foundational areas and foundational capabilities in the model. Alongside that, we are also looking at the readiness assessment that PHAB is doing, and we have a contract with them as well in which we're going to make available for all 115 local public health agencies in Missouri the readiness assessment. And that's going to be a data point which we can evaluate where we're at, where the gaps, where the areas of improvement are for the state of Missouri and its entire public health system.
What did you hope to accomplish as a result of this assessment?
Ultimately, the dream of our FPHS process in Missouri is to request additional resources and funding for local public health in our state. We know because of historic disinvestment in public health that we're quite frankly not doing well enough for our local public health agencies or the people that they serve. And so our dream is that we will, using the costing assessment, be able to actually take an objective number and an objective data point to the legislature and say, this is where we're at and where we need to be and the financial gap between those two places. Will you partner with us? Will you help us fill that gap so that we can do better for our constituents, the people that we serve?
In terms of timeline, does the department have to wait until the analysis is complete to approach the legislature for additional funding?
No, we really can't afford to wait, especially as we are trying to better serve our local public health agencies who are our partners, as well as to better serve the Missourians that rely on the services and the activities of their local public health agencies. We really believe that no matter where someone lives, they deserve to have that foundational level of services delivered to them in their community. That's why it's also important that we look at this from a statewide perspective. As we're moving forward with accreditation activities such as readiness assessments, as we're moving forward with foundational public health services with our cost gap analysis project, we have to make sure that we're looking at every single community to make sure that it's available to every Missourian. So as we are receiving support from PHAB, from the 21C learning community, it's really important to us that we are moving forward in a statewide approach and that we're acting now. How we're fitting that within our project is, although it's a 3-year project where we're gathering information, we actually will be receiving data through that process, each year through an annual report from local public health agencies. And using that information, we can start working on it now.
Jamie, can you explain why the Wisconsin Association of Local Health Departments and Boards opted to use the National Foundational Public Health Services Capacity and Cost Assessment?
The national model had already been vetted pre-COVID by a work group consisting of local and state public health professionals and partially incorporated into our state's administrative code, our DHS 140. This pre-existing buy-in made sense as a starting point from which to assess our system's current strengths, weaknesses, opportunities, and gaps. By utilizing our statute, our DHS 140, this allowed our local health departments to be able to get something additional done of requirement by statute, as well as really set the stage for us to move forward within the national model. Of course, having standards and measures that we could compare made it much easier for us and our local health departments to move that forward.
What challenges did you have to overcome in Wisconsin before you could begin your assessment?
Wisconsin had started with a general talk about funding many years ago. And again, we needed these items to fall into place in order for us to move forward. There were quite a few challenges. We have many new health officers who have been unfamiliar with foundational public health services, so providing some of that baseline education. We had a lot of health officer turnover, not much different probably than across the country, and also had many interim health officers or even vacant health officers. The bandwidth of our health officers and their staff to complete the assessment was certainly a large challenge. We also did the assessment over the summertime where we were battling with vacations and folks being out of the office. And finally, post-COVID burnout, shifting from a pandemic response vantage point to resuming other public health duties and responsibilities. Folks just wanted to get back to their regular jobs rather than going through an assessment process. We had to continually demonstrate the value of what this assessment would look like for Wisconsin's public health system in the future.
Does this assessment align with Wisconsin's overall public health transformation efforts?
Through public health infrastructure grant funding, we've continued our goals and 3 aims on workforce, funding, and legal authority, really finding ways to describe all 3 of those areas. It's important for the state to have a comprehensive point-in-time picture of local health department revenues, expenses, cross-jurisdictional sharing agreements, and how these are allocated across the state. Wisconsin's Division of Public Health does not currently collect annual fiscal data from our locals, so this will help identify gaps and opportunities. This can lead to new service delivery models, training offerings, looking at existing funding formulas, and more. This assessment will be an important piece of the state's larger transformation efforts as we look to build our efforts moving ahead.
Thank you both for joining us today. You can visit the show notes for more information on how you can use assessments as tools to transform your public health system. On behalf of everyone at the PHAB Center for Innovation, thank you for watching.